Now, there's an issue about diagnosing depression in teenagers that I think isn't there for diagnosing asthma in teenagers. I don't think at this point we're worried that we're labeling teenagers with asthma. We're saying we're making a diagnosis so you can get the right treatment so you won't have an asthma attack. Well, we're not quite there with depression, I fear. But we're doing the same thing. We're making the diagnosis so that we can come up with a really good treatment plan. Now, ADAP's mission of getting quality information about depression to the community is based on the idea that we have something to do, that people can get better. And that's the whole point of making a diagnosis, so that you can say, right, we know what you have, and now we can start this, hopefully, successful treatment. Treatment for depression really needs to be comprehensive. It's not simply taking a pill. I think that's important to know. It is a medical illness. It's a medical illness that's very treatable, and the optimal treatment is a combination of medicines, individual psychotherapy or talk therapy, sometimes family therapy. You can imagine the effect of a family of having a depressed teenager who is perhaps not getting along with their parents or their siblings or anyone else. And then it also involves something that I would term individual responsibility, where teenagers have to do some other healthy behaviors. So I'll talk a little bit about each of those. With medication, there are a whole range of antidepressants. And I think the important thing to know there is that with monitoring, there are lots of good options for teenagers, but that it needs to be done under the watchful eye of a health professional. And that if someone's having a lot of side effects or they're concerned, that be a dialogue, that you can try different things so that you end up getting something that the teenager is going to be willing to take. The limitation of medicine, of course, is that it takes a couple weeks to get the full benefit. So you're asking someone going through all of this to hang in there for a couple weeks where they have side effects. That is not a very easy sell for anyone, let alone a teenager whose view is, I'd like it to change now. You can imagine why marijuana might seem like a better idea. It is not, but why it might seem that way. And so with medication, I think the important thing is there are lots of options and that you need to hang in, and that's where being educated and really having that dialogue with your physician can make a big difference. As far as individual therapy, it's a big deal to get this diagnosis and realize you're going to have to deal with it. And I think one of the important things that comes out in individual therapy is talking about your illness, learning about it, but also talking about what it is to have it and what are the changes you're going to need to make to be healthy. And those two things combined have been consistently shown to be the best treatment. Medication in combination with the therapy. Not one on its own, but both together. As I said, for individual people, their family situation might be that this has created enough chaos that talking as a family could be very helpful. So that's a possibility for some families. And let me just say something about individual responsibility. Teenagers don't really like sleeping, at least the ones I know. They want to be up all night on the computer, watching TV or doing something. They aren't necessarily, well, they're not that open to my thought that drugs and alcohol are just a disastrous idea. They usually, that's when I feel old, where they essentially express their thought that I'm just really against this because of my age. And I said, well, no, I'm a psychiatrist. I'm against it because it's going to be a disaster for your mood.